Hi, good afternoon, everyone. Thank you for joining us for today's webinar on investing in mental health, which is part of our BVI Mental Health and Psychosocial Support webinar series. My name is Amy Tausch. I'm a mental health consultant for the Pan American Health Organization, and thank you again for joining us. So as most of you probably know, World Mental Health Day 2020 was on October 10th, this past Saturday. And the theme of this year's World Mental Health Day was investing in mental health. So today we have with us Dr. Claudina Cayetano, Regional Advisor on Mental Health for the Pan American Health Organization, to present on this very important topic. So without further ado, I'll pass it over to you, Dr. Cayetano.
Thanks a lot, Amy. Thanks for the introduction, and I'm so glad that we are doing this webinar with colleagues from BVI. I'm going to be sharing my presentation, sharing my screen. 1 second. Okay. Can you see that?
Yes.
Okay, great. So, okay. Okay, great. So I know you are able to see my presentation, and as Amy has just mentioned to you, thanks for joining us. I know sometimes it's a very difficult time for some people because of the conflict with their work, but we appreciate that you're taking time from work or from home, whatever it is that sometimes you are engaging at this hour. We value the time that people take when they listen to this webinar. So this webinar is on investing in mental health, which is the theme for World Mental Health Day, and World Mental Health Day was last week. But nevertheless, some countries, when it comes to mental health, World Mental Health Day, even though it's October 10, some countries do 1 week activities, some do a month-long activities. So it's never late to be able to have this session. And why this year was selected as as investing in mental health, because on average, countries spend less than 2% of their national health budget on mental health. So this is why it becomes so relevant to invest in mental health. Okay. So so as mentioned before, World Mental Health Day, is the objective of World Mental Health Day is to raise awareness on mental health issues around the world and to be able to mobilize effort in support for mental health. Some of you may recall that we also have World Suicide Prevention Day, which is September 10th, and the same thing, to raise awareness about these issues. We are, for this year, investing in mental health is to increase investment on mental health. So when we investment in mental health programs at the national, at international level, which have already, especially because we know that these have already suffered from chronic underfunding, and so it's very important now more than ever. Now that we have COVID, now more than ever, we need to invest in mental health. So before this, I thought I would start with a clinical scenario. So the clinical scenario is of a 32-year-old gentleman, and it starts by saying that, when I was drinking at the age 32, I didn't look too bad, at least on the outside. I had a lovely wife and 2 kids. We owned a house and I drove a nice car, but on the inside, I was a complete mess. I had a hard time at work, and the work was increasingly difficult. The house and car and I had were expensive and kept me in debt. My wife had to work 2 jobs for us to survive. My biggest problems, he said, were inside my head: self-hatred, acute self-consciousness, fear, shame, and continuous dread of impending calamity. I could not get rid of the feeling that everything was going to fall apart all the time. The alcohol used to stop me worrying about these things. If I had any worries or negative thoughts about myself, I would drink, and magically all the thoughts and worries would disappear. Alcohol gave me boundless confidence. I became loud, funny, interesting, and found everything and everyone enjoyable. But after years of using this magic, it stopped. Alcohol no longer made me everything better. Instead, it brought no relief from the pain and fear I was feeling. The magic door had closed, and I had to live with the pain. For several years, this was my experience of drinking. I would drink to feel confident and have fun. The only problems were the occasional hangovers the next morning. However, in that time, I had become dependent on alcohol. This was evident when I started needing it to get me to sleep at night. If I didn't have a drink the last thing at night, it was difficult to sleep. I would toss and turn and feel terribly uncomfortable. A little drink always worked the magic. So this is a scenario I want us to think of. And I chose the alcohol because most times we don't consider this an issue. And as you see that here, there's a diagnosis of an alcohol dependency. And when we look at the treatment gap in Latin America and the Caribbean, this has not changed. In terms of, if you look at this graph here, you see that alcohol, for example, is one of the highest conditions that have a high treatment gap. So we're talking about close to like 87 of treatment gap, which means that 1 in 10, or maybe if we want to be more optimistic, we could do only 2 in 10 people who have an alcohol dependency or alcohol problem receive treatment. So there's a huge number here, 8 people out of 10 that do not get any treatment. And similarly, that's also what happens when it comes to anxiety disorder, because we tend to think of those things that, maybe your fault is normal, and you don't see them as a disorder, as a problem. We don't see that as a problem. And additional to this, we'll also look at, the other component, which is the stigma and the discrimination. So among the conditions that have high treatment gap, we have anxiety, we have depression, we have agoraphobia, we have alcohol, and those are things that can be treated. So I think it's very important that I wanted to set that scenario and look at the treatment gap so that we could start to see that, set it in a context in terms of why we need to invest in mental health. Because of the cost and cost effectiveness, there's a substantial return on investment in mental health. For every dollar that is invested in scaling of treatment for depression and anxiety, this can lead up to a $4 in return in better health and the ability to work. So we need to be able to look at the equitable access in financial protection. Investment improves equitable access and fairness in financial contribution to essential mental health services. So this helps us to get closer to what we call, from PAHO, we use the universal health coverage. So we want to be able to, investing so people can be able to feel good and be able to contribute to their communities. So it's also there's also a discussion here on the human rights protection, because access to mental health is fundamental human right. It's recognized by the Convention of the Rights of Persons with Disabilities. Yet, as I mentioned before, the treatment gap can reach up to as high as 80% for people with mental health and substance use conditions. So public health and economic burden, mental health and neurological and substance use disorder, we use the word, when we say mental health, neurological, and substance use disorder, we are including conditions such as depression. And when we say neurological, we are including conditions such as epilepsy, dementia. And in substance use, we are including conditions such as alcohol and drug use. So all of those, because sometimes people too make a difference. Say, oh no, but it's an alcohol problem. It's not the same, but it's all the same. It's mental, neurological, and substance use disorders. These are major contributors to morbidity and premature mortality throughout the world. So we know that globally it is being estimated that in 2010, for example, the global cost of mental disorder was estimated to be approximately 2.5 trillion. And by 2030, which not far from there, is projected to increase 240%. So investing in mental health, what and who? So what it is that we need to be doing, and who's supposed to be doing the investment? So in addition to financial investment, investing in mental health can also refer to the ways in which we prioritize and advocate. And I encourage everyone who has joined us this morning to think about that each one can prioritize, can be an advocate for investment in mental health. So increased investment in mental health will require intersectoral collaboration. It is no longer just the role of the Ministry of Health. This is among many sectors. And when we go back to the scenario, you'll be able to see the importance of thinking of how other sectors can also be involved. Government, meaning Ministry of Health, Ministry of Education, Social Development, religious leaders, business community, among others, policymakers, donors, the media, everyone. It's important that they play a role not only in the investing, and then if we're going to encourage investment, we also need to make sure that we encourage mental health literacy, because policymakers need to have mental health literacy. The media, the same thing, so that they understand why it is important to invest in mental health. So investing in mental health, what can policymakers do? They can reallocate investments, because many policymakers sometimes, when they think about building hospitals, they think about large hospitals, and what we want is to be able to present the argument of, yes, we need a hospital. No one is saying that's not relevant. Of course it is relevant, but we need to reallocate the investment to actually invest a lot on community mental health. Identify new resources for mental health. So sometimes we know that there is research to show that increasing tax on alcohol and tobacco may increase resources for health. So we need to be able to foster this collaboration with, customs, immigration, to understand how taxes sometimes is being allocated. Where is that going? Maybe allocate that into health, increasing health in the community. What can donors do? Include mental health in all related programs. Advocate for policy that promote rights of people with mental health conditions. Support development and functioning of services at a primary care level, at the community level, where it's closer for people to their homes. So what can healthcare providers do? Well, healthcare providers play an important role, and there have been research to show that sometimes healthcare providers have also the highest rate of the stigma and discrimination. So it is very important that policies in terms of and training on literacy is a part of the same work with healthcare providers, because we want them to respect people's dignity and promote the rights of people with mental disorder, ensure provision of good quality mental health care within the healthcare system and community. Sometimes if they see a patient that they know suffers from mental health disorder, there's that can be that rejection. So we want to make sure that they can protect the rights of people. What can we as individuals do? Promote positive attitudes, non-discrimination, equal opportunity for people with mental health conditions. So it's very important to educate ourselves, and raise awareness about mental health and human rights issues. It's very important that we support, mobilize people in the communities to advocate for change, to advocate for increased funding. Those are the things that we want to be able to encourage individuals to do. WHO recommends that spending allocation should be in a proportion to the health burden, which means that, if you want to run your house, you need $20 a day, right? So you want to be able to get the $20 to run the house. If you only get $2, there will be some gap. So that we're looking for parity between physical and mental aspects of healthcare. There's international guidelines and evidence to indicate that services for mental health conditions should aim at caring for people in the community, providing integrated services for mental health in primary care or in general hospital, community treatment, plus social support for severely affected individuals. And so, because sometimes what happens when you say community treatment, we're focusing more on medication. But we also need to look at the importance of social support, of supporting people to manage their budget, to manage their social life, to connect with others. So this is empowerment. It's not so community treatment. It also has to do with psychosocial support. But then when you look at the burden, burden of neuropsychiatric disorders could be up to 22%. The burden, yeah. But then when you look at the budget, we're talking of 2% of allocation of this budget from health to mental health. So that's where you start to see the discrepancy, that sometimes the burden does not match the budget that is received. So, and it's important to pay attention to the burden of mental health. It's affected across the lifetime. So, between 5 and 15 years, you have more issues of conduct disorder, anxiety disorders. And this thing, with almost 17% of mental disorders in this age group. When we talk about around the ages of 20, we're starting to see issues such as anxiety, depression, self-harm, and this can account up to 48%. Now we look at between the ages of 20 to 35, I presented a case scenario of an alcohol dependency, because this is where it becomes more increasing, the problems of alcohol, mental disorders, such as schizophrenia and bipolar disorder. So the elderly, we all know that the elderly suffer more from neurocognitive disorder due to Alzheimer's, and this actually surpasses 50% of the burden around the 80 years old. And then we also see now that there's a higher life, the life expectancy has increased. So this is an issue that we need to pay attention, that the burden affecting mental health is across the lifetime. In terms of when we think about the global health spending, as mentioned before, it's very little. But what's the takeaway message here is that most of the reported expenditure that is allocated to mental health is allocated sometimes to mental hospitals, especially but in particular, except in high-income countries where there's less than 43% of spending is on mental hospital. But some countries this is much more higher in terms of the ones that have hospitals. A lot of the expenditure goes into maintaining the hospitals. It's important that when you think about investing in mental health, that we also make the case that we know that poor mental health can cause low educational achievement and school dropout. We know that it increases risky health behaviors. We talk about premature death. We know the issue of stigma and discrimination and human rights violations. And someone with it affects their ability to participate in a daily life in the society. It affects their opportunity for them to, for personal achievement. Caregivers' well-being and family function is challenged. A caregiver that has someone with the home with a dementia or someone with a disability, they may not be able to do, they may have to reduce their working hours. So it is affecting them in terms of their economic loss. The same thing happens when someone suffers from depression or having a mental disorder. There's a high economic and social cost because they are not able to participate at work. They exit earlier from the workplace. They cannot continue working, and so they decrease their income. Or sometimes people are working, and if they have a mental disorder, sometimes it may happen too that their concentration, their ability to focus and engage is not there. So we talk about issues like presenteeism. So we need to shift the paradigms. We need to change, in terms of move from exclusion to inclusion. We need to focus on rights and users in terms of social inclusion. People need to be able to be validated, even if they, having a mental disorder should not be a cause to exclude them. And we need to also move from a biomedical to a psychosocial support. Just treatment, just medication is not what we have been advocating. We want to focus on the social dimension of care, supporting the social part of people. And we need to move from beds in hospital to opportunities in life, to focus on recovery. Having a mental disorder doesn't mean that that's it forever. No, if there's recovery, there's a path to recovery. How do we support that? So from short-term medical treatment to a long-term psychosocial care. where we're focusing on rehabilitation, where we're not focusing on the person hearing voices or seeing things. We're focusing on what they're doing for themselves to take care of themselves. That's what we want to be. That's the shift that we want to be doing. So we know that few people around the world have access to quality mental health care. So we want to be able to move, this year the theme is to move for more investment, to invest in having people have better access. And of course, we have to consider the issue of COVID, particularly COVID. COVID makes this pandemic affects everyone around the world, every person. Of course, more people have a higher risk than others, but it's affecting everyone mental health. So we know that there's evidence to show that this pandemic has likely led to an increase in people developing new mental health and substance use conditions, as well as to a worsening or relapse of those with pre-existing conditions. So mental health systems, which were already underserved, underfunded prior to COVID, need to find themselves even in more strain as they face greater demand for services and existing funding that sometimes is directed elsewhere. So investing more in mental health can help countries to be prepared for this unexpected impact of emergencies and disaster, which take a high toll on mental systems and services. And I think for colleagues in BVI, we have been having this meeting, this emergency in terms of hurricane and COVID, it does have an impact on your mental health. And we need to be able to advocate for more investing on mental health. So what happens is that what are the challenges that we are looking when it comes to COVID? So we know that, as I mentioned before, it's leading to a mental health crisis if action is not taken. People, and when we say people with hypertension, diabetes, or other NCDs, we know they are at a higher risk, or people who are also older than 60. And it's not just here it has all of us. People, last night we had a presentation for healthcare providers, and we say even healthcare providers also have these disorders. So teachers have, any human can have this, so no one is exempt. So there is a higher risk. So we need to make sure that we invest more in mental health. As we know, the more severe cases are among people with hypertension, cardiovascular disorders, diabetes, people who smoke, people with chronic obstructive pulmonary disease, with cancer and chronic disease. So these are the NCDs one. We know that, but I think, as you all know, everyone is at a greater risk. So therefore, it's very important that we pay attention to mental health. And then before, when we used to talk about NCDs, we used to talk, there were only like 5 diseases, 5 risk factors. Now, as you notice, mental health is one of those. So we talk about the 5 diseases, the 5 by 5, which is the 5 diseases and 5 risk factors. And this is again important to pay attention. When you look at the risk factors: unhealthy diet, tobacco use, air pollution, harmful use of alcohol, and you have to add physical inactivity. So those are 5 risk factors that are very, because it helps to protect your health, protect your mental health. And when it comes to NCDs, we used to have only cardiovascular, chronic respiratory disease, cancer, and diabetes. And now mental health condition is another one. And think about it too, even someone who has diabetes, who has cancer, someone who suffers from a cardiovascular disorder, when they have a mental health condition, they're not adhering to the treatment. They don't follow up with the medication. They don't have motivation. They are demoralized. So mental health is cross-cutting. It's not just as a one disease or as a risk factor. It's actually cross-cutting. So this is why, the case for investment. So we have opportunities for the future. In the Caribbean, I'm just presenting this because what we are starting to see now is that there is greater, we also want to be able to look at return for investment. So we're starting to do some work in terms of looking at the case for investment. So Jamaica is the first one that has done this in Caribbean, where they did, and this is a work that we do with our partners in the department or our colleagues, looking at a return on investment on an analysis of scaling of treatment for three conditions: depression, anxiety, and psychosis, the most common ones, at least in the case of Jamaica, and in most countries too. So what was this about investment? It was to look at if we train more people, if we support families, if we do a better coordination of psychosocial rehabilitation, if there's a better coordination between inpatient activities provided by the teams in the hospital and provided by the community, what is that investment? What is this return? So I think this is something definitely very important that we want to encourage countries to be investing more, to look at the investment in mental health. What does that mean for them? We also have done training for school mental health literacy, and that is school mental health literacy. It's directed for teachers, but the mental health literacy cannot be only teachers. It has to be, as I mentioned before, for media, for everyone, religious leaders. Everyone have a role to play, because it helps when we do the training or the work on schools. We are doing that because, as we have mentioned in previous presentation, 50% of mental health conditions start by age 14, which means that the teachers should have the competency or the capacity to be able to see when problems are arising, and rather than blaming them on a behavioral problem, then referrals can be done and discussion with families can happen at that time. So I always say that we don't want teachers to do the diagnosis. Psychologists, psychiatrists can do the diagnosis, but we want teachers to teach. But we also want them to be able to be competent, to have the skills to see when there is problem. We also have these initiatives on, we work on another may not be a problem issue in BVI, but I just started some of our other regional initiatives on the preventing self-harm and suicide, which is a online course, which is a self-learning. People can access that through the virtual campus. We also work on, we have our Atlas, the Mental Health of the Americas. And what does the Atlas do is to help us to gather indicators how countries are progressing when it comes to mental health. And we have some important, if you need to know more about, what is the burden of mental disorder, we have publications on burdens. We have, publications on management of epilepsy. I did not include there, but there is one on management of dementia. And then, of course, building back better, which has to do with emergencies. And then one of another online course we have, as some of you may have heard it before. This was launched about 2-3 weeks now, the psychological first aid. And in BVI, we also have done the training of psychological first aid, which is a course that, so this one is, it's an online, self-paced. You can access it through the virtual campus, so PAHO virtual campus, and it's for, layperson, with the tools to provide initial response for people who are experiencing psychological distress. So I just want to end here. I mentioned the Atlas, but the Atlas helps us, as I said, to measure indicators, to be able to see how countries are progressing, how they're investing in mental health. So some of the areas that the Atlas cover is the policy and plan. We also look at if there is any multi-sectoral collaboration, the financing, the integration, the availability of services and the utilization. Social support is very important to focus on mental health promotion and prevention. Sometimes healthcare providers or mental health providers, we do mostly care for treatment, but very little mental health promotion and prevention. And of course, the issue of mental health, the information. Okay, so let's get back to our scenario. Remember the scenario that I presented? It's a scenario, and we have 80% of treatment gap for substance dependency, but then we know that research has shown that substance dependency can be treated in primary care. But what tends to happen is the stigma and discrimination prevent people from receiving care that they need. The stigma and discrimination commonly apply to substance-dependent individuals, and it's not only them, sometimes even to healthcare providers. So in many countries, what happens in situations like this is that we look at them from a criminal or from a justice. It's their fault. They have done something, so there is a harsh treatment. What is important to recognize is that these disorders, these issues can respond to psychotherapy. They can respond to family support and education. We can provide case management to help the person to be able to deal with that, because we know that the effects of substance use is not only for the individual. It's for the family, for like family breakdown, domestic violence, and neglect of children, and of course poverty, because it decreases the income, and unemployment. So there is all these opportunities that are lost because of a condition that could be treated and is not being treated, and then only because of the low investment in mental health, because of low understanding of these disorders, because of the stigma and discrimination. So why we need to invest in mental health, I think, because we have the evidence that support actions. We have interventions that are effective. Of course, it's very important. Political will is definitely very important to take actions that are sustainable. Financing is necessary to increase the service delivery. So we need to make sure that it's a good allocation of sufficient resources, human. And when you say resources, because sometimes patients that have mental health conditions, sometimes the issue is housing. And that is not the role of Ministry of Health. That's the role of other sectors, other government sectors. So we need to reach to all the communities. Mental health has no border. Mental health is everybody's business. So, and there is no health, we always say that there is no health without mental health. So providing intervention, action across the life course, remember that's also very important. So I want to thank you for the opportunity to be with you this morning to present the case for why it's important that we invest in mental health. So some of the takeaway messages is that investing in mental health will produce significant return, and that we need to be prepared, especially now with the COVID pandemic. We have to invest more in mental health. So thank you. And we have some resources that we always use for this kind of presentation. Over to you, Amy. Thanks.
Thank you, Dr. Caetano. And for everyone joining us, we'll make sure that we make available the presentation as well as the recording. So now we have a little bit of time for questions or comments. And so how we'll do it is if you do have something to say, please just click the raise hand button and I'll unmute your mic so that you can speak. I also thought it might be interesting to hear from any one of our participants if they participated in any World Mental Health Day activities in BVI. I'm curious.
Yeah, that's a good idea to hear how BVI, what kind of activities were done too in terms of commemorating World Mental Health Day.
And feel free to also type any questions into the chat or the Q&A box. Okay, we have Dr. Urbane has her hand up. Let's see, I'm going to... Dr. Urbane?
Am I on? Hi, Amy.
Hi.
Oh, how are you? So last week Friday, my staff and I, in commemoration of World Mental Health Day, we had a silly mass Don't Rush challenge that we extended to all the schools in the territory and everyone that wanted to participate. And so you took your face mask, which you have to wear in this era of COVID, and decorated it how you saw fit, and then you could make your own video or submit your own picture that was posted on BVI-HSA's Facebook page. So, we tried to add a little levity to all that has been going on. And I had a lot of fun, and I think my staff had fun too. Usually we have more activities, outreach and stuff, but because of our limitations, because of social distancing, we decided to have a virtual activity instead.
Oh, I love that. Very creative.
Thank you.
Thank you too. I want to join anybody. Thank you, Dr. Rubin, for a creative way to commemorate World Mental Health Day. Do you and it's good that you also, brought your staff to join in something like that. What do you think in terms of I know the challenges in terms of not being able to do more, but you did what you were able to do. In the previous years, though, is this something that you find that people are becoming more and more are people more and more aware of this day and of the importance of observing World Mental Health Day?
Well, I can say here in the BVI, yes. When I joined the service in 2003, we had a week of activities in May, so we celebrate May's Mental Health Month. That has subsequently expanded into all sorts of activities. For years, we ran the Incredible Race. We're very action oriented at my unit, so we like to get people physically involved. And so the Incredible Race was our signature event where we would create challenges that mimic the challenges that persons with mental illness or challenges have to face in our community. And it all culminated with our Family Fun Day. So I think in this particular community, we've spent a lot of time highlighting and destigmatizing mental health wellness and mental health disorders. So I feel comfortable saying, that we have made the community more aware. I definitely see more buy-in from our government in terms of awareness and making mental health a priority and a focal point as we engage in future planning for the territory. So we have our mental health policy, which informs how we plan our activities. And I think over the past 17 years, I've definitely seen the progression of investment and awareness here in the BVI.
Kudos to you. Thank you. I think people like you definitely helps to move that, to get that movement going and taking it to the community. Congratulations.
Thank you.
I'm glad that COVID did not stop you.
Well, we like to have fun, and one of my taglines that I coined many years ago, and it's still relevant now, is that it's fashionable to be mentally well. And so, so we try to make it as palatable and approachable and acceptable and deinstitutionalize people's perceptions of mental wellness. So we have a lot of fun doing it.
Thank you. And that is what mental health is, taking care of yourself, valuing yourself, and doing this physical activity, as I was mentioning in one of my presentations. Physical inactivity is one of the risk factors. So what you're doing is actually promoting that and sending that message, what the importance. So this is great. Thank you.
Thank you, Dr. Cayetano.
You're welcome. Anybody else who want to join us in the conversation? I know Amy is monitoring who has his hand up if they wanted to, if they have only a comment or if they want to just ask a question, or even just, as Amy was mentioning, just talking about how you, how you advocate for mental health, if there was any activity that you did for mental health. Thank you. Is there anything in the chat too? I'm not seeing any.
No, I'm not seeing anything in the chat or any hands right now.
Okay. Is Dr. Samuel with us? Maybe she wants to add something. If not, then...
She's coming. Go ahead.
Hi. Hi, Dr. Titano. Yes, I'm here. And thank you for that awesome presentation. And when you heard the report from Dr. James, the only question that I had earlier really was about, as we go into this pandemic, my concern is that the resources being allocated to mental health is going to be cut because everything is being cut at the moment. I think you wanted to talk about some ways that maybe we need to workplaces, other agencies need to be looking at how they just incorporate, care and screening and advocacy for mental health into their own places of work or play, because very often we think of mental health as a centralized, and as you say, it needs to be across all agencies outside of health. So, just to emphasize that point, because of the concern that I am having that's coming up later. Thank you.
Thank you, Dr. Samuel, and I think that's a very good point. It's good to hear that you're raising awareness, which is what Dr. Ruben refers to, but then at the same time, you also want to make sure that there is the resources. And the theme this time, it was investing in mental health. So that's what we're looking for, increasing investment, not decreasing in investment. And this actually, your point is very relevant in the sense that we do not want to put everything centralized, everything only on disorder, everything only on hospitals. We want to bring in other sectors. And it may happen that sometimes other sectors are actually mobilizing more funds. So how do we work together to see that mental health matters? So, for example, when you talk about mental health at workplace, what you need to do for that is so that everyone have access to mental health at workplace. So that is something that we need to advocate for. So the idea here is when we're no longer focusing on disorders, we focus on the well-being, bringing sectors that can help us to make the case. Education, social services, the education, and maybe everyone is suffering from budget cuts, but I think for education it's also important because the teachers have challenges. For workplaces it's important because employees, they have challenges. So I think we have to start to find a way to work together. I think probably that Amy had also mentioned in the past that one of the things that we want to work on is on mental health and psychosocial support. And when we talk about mental health and psychosocial support, we want to make sure that we are bringing other sectors, because mental health is not only for mental health providers, it's the social sectors need to be able to do that. So Red Cross, other agencies that are doing something that we're doing that helps to empower that. So I think it will be good that even part of this project is for us to work on developing our MHPSS working group. Other countries are doing it, and they seem to be seeing now, gradually seeing the value, because as professionals yourselves, you are the specialists, but that's for treatment and management. But at the bottom of that pyramid, the intervention, the community interventions are just like what you were doing in terms of raising awareness. So you need to bring more people on board, and I think that will be a good work that we can do to support the having an MHPSS group where other people also are advocating for mental health. I hope that helps. If not, any of my colleagues or anybody else can jump in to add to that. Thank you. Over to you, Amy.
We have another hand up. Verdun Baptiste.
Yes, good afternoon.
Hi.
Yes.
Good afternoon.
I was just about to ask the question, as the doctor mentioned, about psychosocial support, because that crossed my mind, and she went and she mentioned just along the line that I was thinking about. Because to support what she was saying, it is there are other factors or other groups of people who are getting involved, because I'm a member of the Red Cross for years, and just to mention and just to let you know that on the 23rd of August, 22nd and 23rd of August, the Red Cross did put on a psychosocial support training program, of which I was a part of it. And so I know that they as well are getting involved. And the question I would have asked, but the doctor already answered it, what is the relation with psychosocial support in terms of this mental health? How effective is it? How important is it? But we realize it is important, and as I say, to support what the doctor is saying, Red Cross is also doing their part, because they did put on that training. And I believe they will repeat it in the future, because there are other programs that they have going on as well. So I just wanted to mention that.
Thank you, Mr. This is very relevant that you mentioned that actually all that one to do, that's the part. Bringing Red Cross, because Red Cross complements this work. So what we don't want is to duplicate. We want to be able to enhance the work. Red Cross is doing something, supporting the community, and mental health has to be part of that. So we need to know who is doing what, when, and where. So when we do that, as the slogan says, we are stronger together. So definitely Red Cross play a big role. I think we have to, in one of our meetings, along with Dr. Ruben and Dr. Samuel, and then I'm sure we will be able to, invite other people in the community like yourself, I'm sure, and Red Cross, to put together this MHPSS group. It works. I know it works in many settings, even in the Caribbean. Sometimes at the beginning you have your hiccups, but we learn by doing. We learn by planning and by getting together. And as I say, it's not about duplication. Actually, it's about enhancing these services. Everyone needs to take care of their mental health, and the MHPSS working groups can do a good work when we know, who is doing what, where, and then how do we support each other as a group. So thanks for that intervention, Mr. Baptist. So Mr. Baptist is where he working?
I'm working with behavioral health. I'm working with BVI HSA on behavioral health. So I'm already in the system.
Oh, so you're with Dr. Ruben and Dr. Samuel, right?
Yes.
You're part of. Okay, yes. Thank you. Great.
You're welcome.
Okay, so maybe we will be able to finish early since we have another meeting. If there's no other.
Okay, I'm not seeing any other hands up, so this might be a good place to stop, like you said. I want to thank Dr. Cayetano for her presentation, which again we'll make sure that it's available to everyone, and to thank all of our colleagues in BVI for attending the webinar and for helping us to make sure that that it was possible to have this, for all of your support. And a reminder, like all of our webinars, as soon as the event closes, you'll automatically receive a very brief survey. We encourage you to help us by taking the survey so that we can improve the quality of these webinars. So thank you, everyone. Enjoy the rest of your afternoon.
Thank you, Amy, for facilitating the webinar, and good afternoon to everyone. Okay.